Hello, everybody. My name is Dr. Freddie Garcia, and welcome to another Algemet Technologies Stimpod NMS460 webinar. Today, we're joined by Dr. Fred Huey. Dr. Huey, thank you so much for joining me today.
Well, I apologize to everybody. The computer play tricks on me when everybody take the time off to book in this podcast, the webinar, and finally, I got my computer fixed by Apple, and I want to make sure I will give you enough material to compensate for your spending the time fruitlessly with me.
All right, we'll get it done, Dr. Huey. No worries. Dr. Huey, I have a little bio on you. Let me cover it. Dr. Fred Huey is a licensed medical doctor. He's also been a pioneer in integrative medicine. He's a graduate from the University of Toronto, and he's been practicing since 1980. He's also a past president of the Acupuncture Foundation of Canada. Now, when I first got exposed to pulse radiofrequency therapy years ago, Dr. Huey was already a legend. I remember hearing about these miraculous cures and treatments that he was pioneering in his field using pulsed radio frequency. So I'm personally very excited about this webinar, and I'm glad we get together and do it. Dr. Huey, I'm going to be supporting you on the technological side of things. So I'm going to be running his slides. So in this presentation, we have lots of videos and audio. Please turn up your audio if you have difficulty hearing. We're turning it up as much as we can on our end. Hopefully it works out well for you. So Dr. Huey, I'm going to turn off my video for as you present, but I'll be manning the slides and videos. You just tell me what you need to do and we'll do it. Sound like a plan?
Okay, give
All
me
right,
the
the
first
stage is
video.
yours, Dr. Huey.
Okay, please give me the first video. So she have shoulder arm pain since March, and then went to acupuncture 7 times, and then see family doctor. Family doctor take X-ray. They say nothing wrong. This is the way you will be. This is nothing wrong because they cannot see. They don't examine what happened. This is about it. You have okay. This is normal. Okay. This is like goes up. Yeah. Okay. So this is the pain. This one. This is more than 90 degree pain. Okay. Also, look at here. This one you can open up to 90 degree. This one can open up to here. Try to go more pain, right? And then also go in like this. Okay. This one you can go in like this. Okay. And this one you can go up here. This one you cannot go up here, right?
No, I can.
Good. I am going to stimulate one point. Okay, turn around. Okay. Okay.
Wow, 冇搞錯啊你？哇，少少痛啫，可以咁啦。我搞錯啊！哎呀，開心啊！哎呀，開心啊！
Okay.
咁啊！哇，
Just one more.
屬於咩嚟㗎？
Yeah. 就係點咗個穴。
哦，哎呀，神奇啊，神奇啊你！哎
Yvonne，
咩事？
上次
啊
，OK，啱聽你講先。頭先咧，佢提高個膊頭咧，頭先咧提唔起嘅，
痛，
佢嗰個叫 frozen shoulder，OK，
即係好似我咁樣。
頭先咧呢度咧佢
跌咗落地，
跌翻。This one 通常咧可以遞到高，OK，
係啊
呢度咧遞到呢度咧就痛噶啦。而家咧
到呢度啦，幾叻啊！係啊，嗰次啊，許醫生幫我做過，係啊，佢幫我做過，許醫生幫我做過，係啊，希望真係甩身啦，唔好痛啊！Very good。
Okay. Give you next slide, please. 幾耐咧？我咪 Okay, turn it on. Weight problem, but I think on top AC joint you have a bit of frozen shoulder on top.
Yeah.
So now let me examine your range of movement. Beyond that, it starts to hurt, right?
Yeah, start right now.
So this is 90 degree. You got stuck, okay, and cannot go further. You got the body of the tilt, and also if I do this,
Yeah, feeling it.
okay, this only go about 30 degree, whereas this one I can go 90 degree, and this one I can go straight up the sky,
Yeah.
and then so, and also this one if I go rolled in like this, you cannot make it vertical. This one I can make it vertical. Okay, so let's do one spot in the ear. If it hurt you, let me know. Too strong, let me know.
Nothing yet.
Feel the pulsation, right?
You can go more if you want.
So the whole, you can notice the whole face and eyebrows and all that twitch. So influencing the whole nervous system there. Okay, let's see. Okay, you can see nothing to get equal.
Wow.
Yeah, okay.
Yeah.
If I do this, equal.
Wow.
Yeah.
That's crazy.
Yeah, okay, see? I touch some switch, just software. We put software and then do this. But we still have to fix this hardware problem.
Yeah.
Okay? And then I'll do,
So from here,
yeah,
that
For frozen shoulder.
yeah. I did it one time for you.
you did.
Yeah.
Yeah.
I will also, I would say this is last intestine,
This treatment really worked on my mother.
year 15, yeah.
Your mother. Your mother.
I brought her there.
Or your brother.
She wants to come back because she said it really helped her.
Yeah.
The machine. Solomon did it for her.
Yeah, come.
You're lucky you
maybe.
know Dr. Hui.
Yeah.
Good man.
Yeah.
Nice family too.
Yeah.
You're coming to my daughter's wedding
Oh.
in Portugal.
Oh,
Yeah.
wow.
Because you've got some arm pain, I like to treat along the.
Meridian. Yes. This is a 曲折,曲池.
So I'm treating all the three nerves, the radial nerve, median nerve, ulnar nerve. Because you got radiation down the arms and.
This
Okay,
is
let's see.
a lot better.
Yeah.
Okay.
Oh my God. It's crazy.
Okay. Okay, that we
Yeah,
want it done.
much better, but still tender here.
Yeah, okay,
Much,
so
much better.
So I have to do something about this joint. This joint, this one will still be painful when I go across. Not bad.
A little bit, not bad, better.
It's better.
Much
Better.
better. Yeah,
Much better.
It is better.
It was-
Wow.
yeah,
Just take 1 minute maybe.
yeah, yeah.
That's
Okay.
great.
Yeah,
That's amazing.
yeah. I will put some local anesthetic in
So
that.
how long is this treatment gonna last?
The thing is, it will last. Sometimes just like a fire, we put water on the fire. Sometimes the fire come back, but if you put it out well, it's not meant to be temporary. It's meant to extinguish the fire.
Right.
And if you left behind a little bit of fire, they spread back. If you extinguish the last spark, it doesn't come back.
I hope so.
It means need more treatment.
I'm willing to do whatever's gotta do.
What's your job?
I have a painting company, construction company.
Use
Yeah, a
your arm.
lot of wear and tear. Yeah. Over the years, a lot of,
It's overuse.
yeah,
Yeah.
lots.
But one time you thought this machine aggravate you because you suddenly have jaw infection or something. Yeah, it's not. It's just coincidence.
Yeah.
Okay, we can. So I think there should be a slide about with the small intestine 19. Yeah. Okay. So what happened is that a lot of time we try to do physiotherapy and for frozen shoulder, try to wiggle it to loosen up the adhesions. And or you do cortisone injections or you do acupuncture using main acupuncture point. I realized that sometimes it's a software problem rather than hardware problem. If it's software problem, everybody look at the ultrasound and see some arthritis or some tendonitis, will blame on those hardware. But a lot of time it's really a frozen software, just like a cell phone suddenly frozen, cannot move. And all you need is to push a button called control or delete or the shut off the cell phone and it will restart again. And I think for the shoulder, the switch is actually in the switch called small intestine 19, just in front of the anti-triggers. If you fold the saw part here forward, where the indentation basically in front of that cartilage, there's a tiny piece of cartilage called anti-triggers, and then you just do it in front of it. Although we assign the point as small intestine point, but actually in acupuncture meridian, several meridians cross the same location. Just like a subway line, as several of the subway line cross into the same common blue and yang interchange. So although I think I'm doing the yang subway line, but actually I'm also stimulating the blue line. So the gallbladder meridian, the small intestine meridian, and also the SJ meridian, all actually in a close proximity in the location. So I tried it many times and beautiful point. This is a master point for the shoulder. You don't need to know acupuncture point, just raw memory. Remember the little point. Just in the center, I'm assuming you see this 3 point, put it in about the center of that 3 point. But the beauty of this is you don't need to be so precise with acupuncture, you need to be precise. With the Stimpod, you can just move around a little bit in that region. Okay, next slide. You place this. And your name's?
Maybeth.
Maybeth. And she have headache for a long time. And so much so that nearly daily headache and on Tylenol 2 tablets every 4 hours, and also have to take clonazepam, a whole bunch of medication, try to treat the headache. She had very bad neck, so my provisional diagnosis will be cervical headache. And let's see the range of movement when you turn this way. Painful?
Yes.
Yeah. Okay. Turn this way.
Behind
Painful.
here. Yeah.
And bend forward. Painful?
No,
Not bad.
not bad.
Arch back. Painful?
No.
No. So let's use the rotation on both sides as a comparison.
Yes.
So she's a pain in the neck patient.
Yes. Yes, I am.
Okay. So I wet your skin with some cotton ball as
Okay.
I did. And then I know that if I go to your neck, it will work, but just for exploring some switches, I'm going to go away from your head and go to your toes and see whether it will make a difference.
Okay.
And also, if I press your eyebrows,
No, that's why
is
I
it
feel
tender?
pain. Ouch.
Right.
Yeah.
Compare with this,
No, no pain.
no pain.
That's
So-
why the frowning every time I get a headache.
So I want
frown
you to
more.
use your finger
Yeah.
to touch your beginning of eyebrow. There's a tiny hole there. This hole hurt you. This is called supraorbital nerve, tender.
Oh, tender,
Compare
yes.
with this one, the beginning eyebrow. This
No.
is not tender.
Not tender.
So later on, I want you to compare the headache and also compare the tenderness of the beginning of eyebrow.
Okay.
Okay, test your eyebrow again, left and right. Use one finger, press that hole. Yeah,
Okay.
it's tender, right?
Yes.
Compare with the other.
Nothing.
Okay, and right now you also have headache on this side. Yeah. Okay, let me go to the last toes of your foot, and then I will see. I like to make it strong, but if it stings you, I will tune down the current, okay?
I can cope with it, yeah.
You can feel the pulsation,
Yes.
right?
Yes.
Okay, press your eyebrow now. Compare the pain with earlier.
Now it's gone.
Got it? Yeah.
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 Wow.
How's your headache at this moment compared with earlier?
It's going too. Yeah. That's fast.
Yeah?
Mm-hmm.
3 seconds.
Wow.
Okay. I'll do a bit longer time. I am a perfectionist. I want to go more. There's an interesting meridian called bladder meridian. It starts from this end up in that one point.
Wow.
This is called bladder 60. That's bladder number 2. So if you got subway line problem, you can send in policemen from any one station. You can send in the opposite end of the subway line, and before you know it, policemen arrive at the other end of the station and clean up the criminals in that station. And okay, press eyebrow now.
Gone.
Yeah.
Yeah.
How's headache at this moment?
It's gone.
Yeah.
That's wonderful.
Yeah.
Yes.
Yeah.
Because I took my painkillers at, what, 6:30 this morning.
Okay, turn your neck left and right. How's the pain?
Better.
Yeah.
Yeah.
So
I can turn more.
this is not an infomercial, right?
No.
You're not paid.
No. Not
Okay.
commercial.
So is
So-
this just temporary or would it be
No.
last long?
It lasts long. That's the beauty. I reset. Okay, I will add a few other points to
Okay.
make it.
Factory reset.
Wow.
Yeah, a reset.
What's the warranty period?
And yeah, well, unless the husband don't disrupt the setting again, everything blame on you. If there's any recurrence, it's you.
Pain in the neck must have been developed over the centuries
Yeah.
as a culture because of certain relationships.
Okay. So this meridian go from the toe, go up the back of the neck, and go up to here.
Wow.
So wherever it covers, it cleans up.
That's wonderful.
So how's headache now?
Gone. Yeah. That's wonderful.
Turn the neck left and right.
More movement.
Yeah.
Yeah.
So if I were to touch here, it fixes the headache, no big deal. But you can shoot a golf ball with the eye closed and backward and get it hole in one into the hole. You feel great about it.
Yes.
Okay. Well, this is logical point. I would like to do that also, but just to be sure that I reset some of the nerve. I go to the greater occipital nerve, lesser occipital nerve, and so traditionally, usually doctor use nerve block and anesthetic, but then they only last so many hours. Come back tomorrow, come back tomorrow, come back tomorrow, and just to block the pain.
Mm-hmm. They're going after the symptoms. You're going after the root.
Right.
Yeah.
I reset.
Reset. That's good.
Yeah, good that I document it. Otherwise, if you tell people, people will say, "Nah, it can't be."
Mm-hmm.
Now feel your eyebrows now.
They're both the same.
Yeah.
Yeah.
Now,
Wow.
remember turning the neck movement. Turn the neck this way. Okay.
Yeah. No.
No. Turn the neck this way.
No. Just turned it. Yeah. That's amazing. That's more movement.
Okay. So,
Yeah.
One time will improve you a lot. Let's say not arrogant that one time will cure your whole lot of eyebrow problem. Let's come back for a few treatments.
Okay.
And then each time will progressively fix you.
Okay.
Okay, good.
So yeah.
Okay, so this is the happy result, and this is not by chance. I have repeatedly do headache. I often ask people to press the beginning eyebrows or press the eyeball. The headache sometimes appear inside the eyeball or sometimes eyebrows. So next slide, please. Today is 15th of April, 2024. And I'm seeing Beverly here. Beverly, you come in today, you mentioned you have very frequent migraine and with aura coming. And I asked whether you have severe headache today. You don't have, but I said, well, like any fire, there's a spark, there's a pilot light. I think the pilot light is still present in between flare. So I asked you to press your eyebrow, and the beginning of eyebrow, there's a hole where the nerve come out, and I say that's sensitive. And then the other side, the right side, not sensitive. Right. So I asked you to compare before and after. And I proposed you a very interesting proposal. I said, I'm going to touch on the last toe and see whether it disappears. It sounds so unbelievable. I think it's impossible. So, and I did. I touched you for 2 minutes, and I asked you right away to press your eyebrow. Gone, right?
Yes.
And then I asked you to compare the left and right.
Yeah.
And it was unequal before.
Yes.
And you also have a bit of heaviness of the head.
Yeah.
How's your heaviness now?
It seems okay.
Yeah.
Yeah.
So
It does seem okay.
again, I have documented another patient with a similar pattern, but there's not just occasional success. I did you another typical one. So I touched the one point on the toe. It instantly disappeared. So I believe that, like the other patient, if we do a number of times, I take out the pilot light. Without the pilot light, the wind blow on it, it doesn't ignite. Okay?
Yeah.
So I just want to document today's success.
Yeah.
It sounds quite impossible, right?
I know. It does. It does.
It's just the logic between head and toe.
I know. I know.
Yeah.
Yeah.
Okay, very good. Okay, thank
Well,
you.
thank you.
Okay. For headache, if you look at this is called the bladder meridian. And in acupuncture, for those that's not acupuncturists, It does. You don't need to know acupuncture. I'm just teaching you some switches. Just raw memory, the anatomical switches, it works. But this is the meridian for the bladder meridian. It goes from the last fifth toe, the outer corner of the nail bed of the, is the nail bed on the lateral nail bed. And then the meridian go up all the way, go up to parallel track and pass by the back of the neck, occipital nerve, and end up in the eyebrow. And then that point in the eyebrow is called bladder 2. So theoretically, you can send input along anywhere of the subway line. What acupuncture point to me are about resonant point. They are of the same frequency, of the same octave. So as long as you hit the same frequency, the relevant instrument, musical instrument will vibrate with you when you hit the same right frequency. So when you simulate the last toe, all the acupuncture point will vibrate. When it is slightly deviated, when it vibrates, it falls back into the default setting. So therefore, it's time to tend to adjust all the meridian point along that frequency back into the innate resting potential and resting frequency. Okay, let's look back to the previous one step on the video on another patient with migraine, but this time this migraine is in the eye. It's April 23rd, 2024. I'm seeing Carrie here. Carrie, you have headache, migraine headache for a long time. Tell me, how many years do you have headache?
Oh, off and on for, I don't know, but a long time.
30 years, 20 years?
Yeah, probably off and on for 20 years.
Yeah. And then, so when you approached me, how bad were your headache at the time?
Yeah, quite bad.
Yeah. Most days?
Yeah, sometimes continuously.
Yeah. And then make you very sick, not functional.
Yeah.
Yeah. And nauseation, headache.
Yes.
And light sensitivity.
Well, it's hard to function, right?
Yeah. So I introduce you the machine, to radio frequency machine. We touch on acupuncture point and touch on the headache nerves, and then tell me about the progress when you receive it. When did you notice the first difference? Was the first treatment, right?
Yeah, the first treatment you did, yes.
And then
I came back a week later and you did more.
Yeah.
And then I think I came a couple more times and I haven't been back since, and I'm good. I haven't had a headache at all.
Yeah. So maybe you have about.
So you're looking 2 or 3 months that I haven't had a headache, right?
Yeah, that's wonderful. And we've probably done what, 4 treatment?
Yeah.
And then for 4 treatment, we'll cure your long serious headache. That's a good result.
Yeah, that's amazing.
Yeah. Okay. So, okay, I just want to record that.
Yeah. Thank you.
Carrie, one additional supplement comment, what you say?
I used to go to the chiropractor all the time just to relieve the headaches, but I haven't gone to the chiropractor either.
So even the chiropractor, it relieve you, but within days the headache come back, right?
Yeah.
And then now you
Yeah,
have.
I'm good.
Yeah.
So.
Okay, very good. I just want to document it. It's October 28th. Yeah, this is an acupuncture point. In fact, the liver meridian, if you see on the big toe, between the big toe and second toe, when you take to the top of the intermetatarsal space, and then if you either do acupuncture or do the Stimpod there, it really works all the way. If you look the right side picture, it go up to the eye. So anybody with a migraine headache in the eye, I will use this point they have a migraine headache whole head, but I asked them, do you have it in the eye? And they would say, yes, it is in the head and in the eye. Then I say, press the eyeball, make sure this side is more tender on the other side. Now I'm going to stimulate between your first and second toe and tell me how's the tenderness. Immediately, people will tell you, oh, my migraine disappear and the eye pain and pressing the eyeball no longer tender. So the earlier video I was about to show is a glaucoma patient. It's the same thing. As long as there's a software disturbance relevant to the eye or the head that we predominate on the eye, you can use this point. Let's go back to that particular patient earlier with the glaucoma. It's October 28. I'm seeing Luz here, and you came in because you have long time glaucoma, right?
Yes.
And you were on glaucoma eye drops, but recently because of cataract surgery, that was 2 years ago.
Yes, it was 2 years ago.
And then doctor said, oh, you don't need to do the eye drops anymore.
No, yes, I was taking Lumigan, one drop at night,
right.
And then they say stop taking that.
But then how long now have you been feeling discomfort in the eye now?
It's probably 15 days, so around 15 days 15? I started feeling a pressure, and especially in my right eye, and I feeling pain, especially at night as well.
So are you waiting for an ophthalmologist appointment?
Yes,
but in the between, what I'd like to do is I ask you to press on the left eye and right eye. Mm-hmm. The right eye is a lot more turgid, more like a balloon blown up.
Yeah.
And the left eye is normal.
Yes.
So, and also there's discomfort on pressing, right?
Yes, yes.
So,
pain.
What I did is I used my Stimpod machine to stimulate between your first and second toe. Yeah. And within seconds, I asked you to become equal.
Yeah.
The same equal tenseness and also the discomfort disappeared. Like both eyes become equal.
Yeah.
So based on this success, let me try for twice a week for 1 month. See that we can retrain some of the software of your eye. Okay,
that sounds good.
Okay, good. Today is 14. Okay, so for the migraine or for the head, if you look at also the next slide, this is actually, I tell people, I treat you like an animal. In an animal, a four-legged animal, between the first and second toe and between first and second finger is the same equivalent point approximately. So we call this large intestine 4. This is another useful migraine switch. And therefore, I treat my patient like an animal and with 4-point equivalent. So you can do level 3, which is between big toe, and level 4. And this, I don't use a lot of acupuncture point. When I do acupuncture, I usually do 1 or 2 needles. And with the Stimpod, I can also do just 1 or 2 point. And as long as you have something to compare, make sure the patient see the immediate benefit. And you got your switches and you got the software rebooted. Okay, next slide. It's October 28th. Next slide. Today is 14 of August 2024. I'm seeing Ines here. Ines,
yes, hi, hello.
Today you come to me. You have very painful in the pelvis area.
Yeah.
And ultrasound saying that you have some type of something called adenomyosis, and you have very heavy pain in the pelvis area, and then you were having heavy bleeding.
Yes.
Yeah. And today also is your worst day. You're having bad headache.
Yeah.
So just now, what I did, I go to your ankle and go to your leg, and I put on something called level 4, level 6. You can see the indentation there with my machine, and then right away I asked you to press. You remember I asked you to press the tummy before was very painful. And after I stimulate for a few minutes, what percentage change is the pain on the tummy now?
Yeah, I feel much better. It's 40% less.
Yeah, okay. But now we're pressing.
Now, after you do it more, it's become less.
What percentage reduce now?
Less pain?
Yeah.
Maybe 60, 70.
Okay, good. And then you were also having headache. Right?
Yeah.
And then I put it on your finger here.
Yeah.
And then you start to also put in something called liver 3.
Yeah, I feel like a wake up.
Yeah.
Yeah, more refreshed and wake up something different.
Yeah, okay.
It's happened, yeah.
So I just want to document this.
Yeah, lighten. Yeah.
You're starting to your voice even come back
up. And my voice is much better.
The face.
It is.
Yeah.
Your voice was so down and so hoarse.
Yeah. It shows that.
Okay, I want to document it. So for the pelvic pain, I want to share with you 2 points called liver 4 and liver 6. You don't need to know the acupuncture point. One is at the ankle, in the medial ankle, where the joint line is. So you can see that the medial malleolus bone, and then when my finger is touching the joint line, not exactly in the center of the ankle, but in the lateral aspect near to the medial malleolus. So that point is called liver 4 meridian point. Next one. Next slide. Okay, this is liver 4 meridian point, right at the lateral aspect medial ankle. Next slide. Okay, somehow we missed, maybe in the slide below, it's called liver 6. Let me double check. Yes. No, okay, we missed, this is liver 6, liver 6. Okay, earlier, just go down the slide. Okay, next is the one showing the shaft of the tibia. Okay, we probably missed putting the point. So it's about middle ankle and going upwards, about halfway through from the ankle, medial malleolus to the knee joint. If you go halfway, it is basically in the medial aspect of the tibial bone. And you can go home and look up liver 6. And basically it's the midpoint, about midpoint on the middle aspect of the tibia. And if you stimulate these 2 points, liver 4, liver 6, it will track all the way into the liver meridian into the groin. Can we go back to one of the slides and in which I show liver 3, it tracked to the eyebrow, I track to the eye, and see whether we can find one of the slides to explain the liver meridian. Yeah, okay. The liver meridian here is actually, you can see from the toe, the liver 3 is between the first and second toe. Liver 4 is at the ankle, and then liver 6 is about halfway up the shaft of the medial aspect, and then you can see they go into the groin. So if there's any pathology, if there is any software deviation, when you clean up and reset the frequency of the functioning, vibrating nerve and vibrating cells, it will fix pelvic problem. So I love to show off when patients, sometimes some young female so happen to be around their period time, and they all have some tenderness in their pelvic region. So if I so happen to examine them, I say, okay, press on the left side, press on the right side, and whatever side they were hurting, and I stimulate around the middle ankle and the middle shaft of the tibia, and then the pelvic normalize and the period cramp disappear. And I've done it millions of times, if not thousands of times, and it consistently works. If there's many software problems, such as a period pain or menstrual pain, or people even have any type of lower quadrant pain, such as diverticulitis. I find that many people come in with long-term, lingering, chronic diverticulitis. I stimulate liver 4, liver 6, it go in the groin and go in the pelvic region. Okay, let's go. Okay, glaucoma. Okay, pelvic pain. Next one. Okay, this patient have a right upper quadrant pain. Let's listen to the story. It's April the 18th. I'm seeing Celia here. Celia, tell me what happened with you.
It's just that I have a dull pain on
Right.
my right hand side.
Right.
That goes back in the back, in my back.
Okay. So if I ask you to press yourself, compare pressing here, compare pressing here. This is painful.
Yeah.
Not painful on this
No,
side.
no.
Painful on this side. So if I were to pen you, it's painful, right?
Yes.
Yeah. Okay. So I am. I hope it's as simple as a software problem of this region. You already have your gallbladder surgery many years ago.
Yeah, 14 years.
So, but I'm going to touch on 2 special points and see whether I'll get some wet paper. Yeah. Your skin here. Watch your skin here. Good enough. I will stimulate one spot here. I'd like you to press on the tummy now. How's the pain? How's it?
No, I don't.
You don't feel it now?
No. Why is that?
We'll fix it.
Really?
Yeah. Without touching your liver, by doing these 2 spots, we reboot the system. Strange, eh? Press hard. You compare left and right. You can compare left and right now. It was more painful this side than this side. How's it now?
Well, I don't feel it right now.
Yeah.
We'll have to see. Maybe tomorrow, doctor, should I hear it?
No, I think hopefully I just reset your.
Okay.
Just the cell phone goes wrong, you just reset the cell phone. Yeah. Strange. Without touching.
But I still want blood test, doctor.
Okay, we'll do the blood test to double check the liver and all that. You couldn't believe it's so simple.
Exactly.
Okay, good. Okay, so let's show the acupuncture point. The one for, again, it's not logic, but I was told and was taught that for upper quadrant pain, you use something called triple heater or triple warmer. And for those of you who don't know acupuncture, you can just put down acupuncture point number 6, triple heater 6. If you put in on the label here for triple heater 6, and people will tell you the anatomical exactness is between the ulnar and also the radial bone, and then in the interosseous membrane, and it's about 4 fingers from the wrist crease. So if I have a crease on the wrist, it's about 4 fingers north of it. If I put 4 fingers north of it, is about the point. Again, the good thing with Stimpod, if you're not exact, the vibration will hit the receptor within the acupuncture point and get the same effect. So forefinger right next to it, and then that's a triple warmer, triple heater 6. Next slide. I think this is called the gallbladder 34. It's at the anterior neck of the fibula. So if you see the fibula have a neck, an anatomical neck from the head, right at the neck area is the gallbladder 34. So I was just told for the right upper quadrant pain, you use the right gallbladder 34 and the left triple heater 6. And then if a person have a splenic pain of the opposite side, on the left side, I will use the left gallbladder 34 and use the right triple heater 6. Now I have to be so selective when I use acupuncture. I want to minimize the acupuncture needle. But if you don't remember, doesn't matter. Hit both sides. Hit both sides bilateral gallbladder 34, bilateral triple warmer 6. You'll get the same result. Okay, I'm glad that I demonstrate to you that Stimpod, interestingly, the radio frequency can vibrate the vibrational point, and other than our observation of stimulating local nerve, it can actually do more things. And if people that know acupuncture can actually stimulate acupuncture point, and the body seems to receive it. And the people that can ever know stellate ganglia, many nerve ganglia, and whatever the indication for stellate ganglia block for anesthetic, we can also use the Stimpod to stimulate the branching ganglia. Ganglia are the relaxation of nerve. And well, I have unlimited video to show you on unlimited condition, but I just highlight some of these interesting cases and hope that you can explore with Stimpod. And if you don't know acupuncture, look up some acupuncture cookbook and then try it on patient, nothing to lose. Thank you very much.
Dr. Huey, thank you so much for that. That was amazing. The stories that I've heard about you and your care, they're all true, especially since I just saw them on video. I've always heard about these miraculous treatments that you're doing with the Stimpod, and that's incredible. Let me ask you a quick question before I let you go. And again, thank you for your contribution to this webinar. What, as a trained acupuncturist, how much are you using your needles now relative to the Stimpod? Like, how much do you use both things? Do you ever use both things on one patient? Like, how's that looking nowadays?
90% of time, I don't need to use needle now. I hardly ever take out my box of needle. So I think I'm not likely to. I have a lifetime supply of needles in my box. I think before I ever finish with practicing, I don't think I will finish my supply of acupuncture needle of what I already have in stock.
That's incredible. Yeah. Wow. That's incredible. Well, thank you so much, Dr. Hugh. Really appreciate it. And well, you know what? You said you had lots of videos. Maybe when you have more time in the future, I know you're very busy at your practice, but maybe in this fall or coming winter, we can get you back on and we'll show some more videos of your amazing cases. What do you think?
I have many conditions, things like regional pain syndrome, shingles pain, and neck radiculopathy, sciatica, carpal tunnel syndrome, gout. These are all very treatable with Stimpod.
That's excellent. All right. Well, thank you, everybody. And sorry for the technical difficulties yesterday, but we hope we'll work hard to get this video to everybody as soon as possible. Thank you very much, Dr. Huey, and we'll have you back on for a future webinar. Enjoy your rest of your evening, everybody. Thank you. Bye-bye.
Thank you. Bye.